Hi, Dr. Sasse here from Sasse Surgical. I'm going to try my best to answer in a short little bit of time how to lose weight and keep it off, being the most important aspect of it is the keeping it off. So if you hang in there till the end of this video, I'm going to give you 3 key points that I think will help guide you and will help you be successful in keeping it off. So let's just for starters start with how to lose weight. And this is going to depend a lot on kind of where you are in that weight gain path. So as you may know, population studies demonstrate that everyone is gaining weight. Generally, it's a linear increase over time and with age. And where you are in that weight gain and how old you are is going to dictate a lot about how successful you might be at changing that trajectory and changing that curve. We know that younger people are going to be a little bit more successful with changes in their lifestyle, with their diet and exercise plan, in changing that trajectory. We also know that people who have less pounds on board will be more successful at changing that trajectory than people who have more pounds on board. And so the data really suggests that the helpful kind of framework to look at is your BMI or your body mass index. I know it's not perfect and there's a variety of sort of complaints and reasons why BMI is not a perfect predictor of health or the amount of excess weight, but it's at least a pretty good useful framework, and there is a lot of data that shows it correlates with some important endpoints like risk of diabetes and life expectancy and so forth. So it's not completely useless. So what you should do is plug in your height and weight in a BMI calculator and come up with your BMI. So if your BMI is over 25, then you're right, you are overweight, at least according to these conventional criteria. And it's probably worth effort to try to lose weight. So if your BMI is right in that low range, say 25 to 28, somewhere in there, you definitely have a fighting chance by changing some things that are going on in your life with the amount of exercise you're getting and the kind of foods you're eating and drinking. And you might say, Doc, I've been doing that forever. I go to the gym 5 times a week. I also do, very good exercise all week. Plus I eat very disciplined menus with vegetables and protein and very little carbs, and I don't eat junk food, etc., etc. And that might be true, and what you're bumping into then is that a lot of this does not have to do with what you're doing, and it may be very hard to change that trajectory because it has much more to do with the environment and your genetic template interacting with that environment. But let's assume you've not done everything that you can to lose weight and change that trajectory. What I'd recommend is that you take a good, clear, honest appraisal of what your exercise is every day, every week for the last couple of weeks. In fact, it's helpful to keep both a diet log and an exercise log. And just be honest with yourself. You're the only one who's going to look at this. And then take stock of what you've been doing and how many actual minutes you've spent exercising every day and what you've actually been eating and drinking. And see if there's ways that you can make improvements. And we're just talking about kind of 10% improvements here. You don't have to, have a wholesale change right away. But what I would examine, for example, is how many minutes every day you are exercising, for example, walking. And if you're at the gym, how many minutes are you actually exercising? And likewise with your diet, take a look at the carbs that you're getting in that we know are the main culprits driving excess hunger and more weight gain and fat storage. And then see if you can make a 10% improvement. So it might mean cutting out something that you don't love but you tend to get as a side, like your chips or your French fries that you just don't really need. Or it might be shifting from full calorie, high fructose corn syrup, sodas or shakes to water or a diet drink. Those small things can make a difference over time in the right person. So I think it's best to think about that framework if you're in this BMI 25 to say 28 or so. Now, if your body mass index is over 28, then you're going to find that it's more difficult to change that trajectory. So you might want to seek medical help. There's strong data supporting a more disciplined approach using multidisciplinary interventions and the use of weight loss medications. Weight loss medications, there's 4, actually 3 currently that are still on the market that are FDA approved in the United States. These can help move the needle on the scale a little bit. So oftentimes people will get 5, 6, 7% total body weight loss with the current medications. And with that same diligence, paying that close attention to your diet regimen of reduced carbohydrate intake, more emphasis on protein and vegetables, and exercise. And exercising every single day, 7 days a week. That's what we, advocate at our clinic and center and for all of our patients is It makes it easy. There's no days off. You don't have to figure out which days you exercise. It's every day, 7 days a week. So that might mean something really intensive some days at the gym, and other days it's taking a 45-minute or 60-minute walk with the dog or the spouse. So what if the BMI is even higher though? Well, at this point, you also have to factor in what health problems you're encountering. So if your BMI is over 30 and you're experiencing some additional health problems that are weight-related, most classically high blood pressure, type 2 diabetes, or sleep apnea, then you really would be well advised to attack this more aggressively and seek medical attention. And I would try to seek out a multidisciplinary program that emphasizes the diet regimen I was describing, exercise regimen, medications, and also some psychological counseling, and see if you can bring all those forces to bear to move the needle. What if the BMI, however, is over 35? Then where do we stand? At this point, the statistics show that it's very unlikely for people to be able to change that trajectory in a durable way without surgery. And I know you might be thinking, oh my goodness, I am not interested in weight loss surgery at this point in time. I just wanted some tips on exercise and diet. And I think that what we can tell from the huge amount of literature studying non-surgical weight loss is that those programs have been generally unsuccessful. In fact, pretty much uniformly unsuccessful if we're to believe the largest meta-analyses of non-surgical weight loss programs across the world. In the peer-reviewed literature, that does not mean there aren't anecdotal exceptions or that I have a friend or an uncle who lost 100 pounds and kept it off. But in the peer-reviewed literature, where we all have to really be accountable and those people have follow-up over the long term, we've not yet been able to bring a structured program that creates meaningful long-term weight loss. What you find is that people are able to move the curve for a year or sometimes 2 years, but then the weight resumption occurs. And this is not that it's a person's fault. This has to do with the intrinsic biology of what's called metabolic adaptation. And what we've seen from the NIH studies and others is that when we do that vigorous diet and exercise, starting at a BMI that's up higher now, 35 and greater, we have a tremendous backlash occurring in the body where our body turns down its own metabolism and revs up a bunch of hormones that are causing weight gain. So if you have had rebound weight gain trying to work hard at it, this is not your fault. This is your own physiology experiencing metabolic adaptation and forcing you to get back on that trajectory of persistent elevated weight. So at least consider the idea that surgically changing the tissues, which changes that hormone profile and results in mostly long-term significant weight loss, might be something to consider once the BMI is over 35. Certainly once the BMI is over 40, now we're really in a territory where there is extremely little evidence to show that we are able to create long-term sustained weight loss and health improvement without surgery. The good news is that the surgery has become increasingly safe, very effective, and very non-invasive. So the procedures mostly done today are safer than an appendectomy or a gallbladder or a knee surgery or a hernia repair or a hysterectomy or on and on. One of the safest procedures performed takes about 45 minutes, and most people have an enduring, long-term, successful weight loss journey. BMIs over 50 and 60 and beyond, same story. We need all of those elements brought to bear, everything that we can throw at it. We need to hit it really hard, including surgery, including counseling, including diet, including exercise, and try to change that curve. It's very difficult. It's a very formidable health problem that we're all facing. So back to where we started at the beginning. So what steps would you take if I could crystallize it down into sort of three key points for you if you're trying to figure out how do I create long-term weight loss, or how do we lose the weight and keep it off? I would say one element is that you assess your own body mass index and find out where you are in that journey, and then take stock of your age. The older you are, the more aggressively it's going to have to be done, and the younger you are, the more fighting chance you have with changing diet and exercise and habits. So take a look at that, assess BMI and age. Secondly, keep an open mind to all the therapies. Weight loss medications might not sound too appealing, you might not feel like you need them, but the evidence shows that they do actually help. And for people who are struggling to lose that weight, it can make a big difference in health improvement. Same thing with surgery. It might sound super kooky and scary, but the evidence is very clear that once the BMI creeps up over 30 or over 35 and definitely over 40, that it is very unlikely that we're able to change that body weight. And the evidence shows that people live longer, healthier, happier lives with weight loss surgery in that example than without it. So keep an open mind to the therapies as they evolve and become safer and better. And thirdly, I would say is that don't beat yourself up about it. This is not your fault. This is an epidemic that's occurring because of our genetic programming and the environment that we are living in, and how those two come together to create an immense amount of weight gain. And so, yes, you want to work at it. Yes, you want to take stock of your exercise, increase your minutes, aim for zone 2 exercise, as many minutes as you can carve out 7 days a week. Aim for healthy vegetables and protein and low carbs. But stop beating yourself up about this. You are doing a great job working at this and fighting it, and this is not something that is happening because you're some kind of failure or you've done something wrong. This is a big biological problem that we're all trying to solve together. All right, I hope that framework has been helpful for you. Do know that there are solutions that you can lose that weight and keep it off for the long term. You just have to keep grinding away and get the best possible professional advice about it along the way. Okay, I hope that's been helpful. Good luck to you.